Good morning. It's a beautiful spring morning here in Northeast Ohio, and I want to just take a few minutes to talk with you about some of the emotions that surface in the face of an adverse patient outcome. We've talked before about what it means to be what the literature calls a second victim. Now, there's some controversy around that term, but I like it. I like it because it captures the fact that for the healer confronted with an adverse patient outcome that they wonder about, they wonder if they might have had a hand in it or maybe could have prevented it, there is a sense that something traumatic has happened to them as well. They are also injured. And one way that we're going to address that adverse patient outcome is by addressing the injury to the healer as well. So in the aftermath of that adverse patient outcome, as I've written before, there are a whole lot of emotions that emerge, sometimes very rapidly and sometimes really forcefully. And here's the interesting thing. The more committed that healer is to their work, the more committed they are to their patient, the more committed they are to doing right by their patients, the more strongly they may feel these emotions, the more strongly the fear, the anger, and the self-doubt may come over them. So today I want to talk particularly about two of these emotions and distinguish between them, because I think until we learn to clearly name the emotions, it's difficult to know what to do with them. They just feel like a Pandora's box, right? Well, we're going to take things out of the box one at a time and take a look at them. And today, the two that I want to look at are guilt and shame. They frequently emerge in tandem, and we often mix them up, right? We assume they are similar, that they are united in some way. They're actually two very different things, and they require two very different approaches to healing. So let's talk about guilt. What is guilt? Guilt is a sense that I've done something wrong. I've made a mistake, right? Whether or not I've actually made a mistake, I feel like I have. There was a beautiful essay recently in, I believe, the Journal of the American Medical Association, written by a psychiatrist on the subject of guilt in physicians. And I'll put a link to that essay in the notes that you'll find below this video. So that is one piece of the puzzle, guilt, the sense that I have done something wrong. Shame is another story altogether. Shame is the sense that I am what is wrong. I am the mistake. You can see where that would run down all kinds of dangerous paths, right? It turns into abusive self-talk, turns into turning on ourselves with words like, I'm a loser. Stacia, you don't belong in medicine at all. Who do you think you are to be taking care of patients this way? Who do you think you are, a surgeon may say to themselves, to be putting your hands inside a patient's body, right? That is shame. I am the mistake. Now, they each require different paths for healing, and in the future, we'll delve a little bit further into what each of those calls forth in us in order for us to heal. But for today, I want you to just take note of the difference. And as you go through your daily life, whether or not you're grappling with an adverse patient outcome, I want you to ask yourself how you think of yourself, how you think of those around you when it comes to your or their not meeting up to some kind of standard. Are you thinking to yourself, I am a loser, this person's a loser? Or are you thinking, I've got room to grow, there's a mistake here, there's something that doesn't measure up. This other person over here, they've got room to grow. How can I help them to perfect the art of what they're doing, to help them cross that gap? All right, That's it for today. I wish you a beautiful spring day wherever you may be, or I suppose if you're on the other side of the equator, enjoy your beautiful fall day, and we'll connect again in 2 weeks.